I have mixed news to report to you today. We are seeing an increase in the weekly case count, but we're seeing more testing and a similar percentage of people who are tested that are testing positive. Here are the numbers. Since this time yesterday, we've identified 84 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 32,432 since the beginning of the epidemic. Now, the past week that ended last Saturday, August 15th, by the date in which the test was run in the laboratory, we averaged 122 cases per day. That's an increase from 108 cases per day the week before that. If you've been following these weekly numbers, you may notice that last week I reported that number being slightly less. I think I said 105 or 106. Some of the laboratories send their data to us late, and so some of the past week results, it takes a while for us to get all of them. That 122 cases a day is similar to the 124 cases per day we saw 2 weeks earlier. As we've seen in the past, the new cases are still predominantly younger people. More than 50% are under the age of 40. Last week, we averaged 4.0% of people who tested were testing positive. Now, we have some delays in laboratory reporting, particularly this week, and so that percentage may rise in the next few days. But it's very similar to the 4.1% that tested positive the week before that. We have 0 new deaths to report today. The total number of deaths since the beginning of the epidemic from coronavirus is 1,717. We're running just above 7 deaths per week, or just more than 1 death per day in recent weeks. We often hear about the deaths in batches, though, so we don't hear about them every single day. On testing, we have some good news on that. We are increasing the number of people who are being tested. We're over 3,000 tests in the past week. And we're seeing some improvements in the delays in reporting results of people who are being tested. Across all of our sites, the average delay now is 2.0 days between the time of the sample collected and the time in which a person has received the results. The one laboratory that has been delayed in the past, Quest, had a delay of more than 7 days. They're now 4.8 days, which is still too long, but it's clearly moving in the right direction. If people want to know where they can get tested, they should go to our website, www.phila.gov/testing. The map on that site there, which shows all the testing sites, has been updated to show more information. In particular, it now shows where children can be tested, because I know that many people have questions about where children can be tested. Across the region and across the state of Pennsylvania, like Philadelphia, case counts have not changed much in the past week. We appear to have stabilized. In the United States as a whole, case counts are still very high, but they are declining, decreased about 16% in the past 2 weeks, according to data as tracked by the New York Times. So that's where we are with the epidemic. I thought I would take some time now to just update people on where we are with vaccination. There really is exciting progress on vaccination. Vaccines are now being tested. Now there are nearly 40 different vaccines that are being tested on humans. 3 of those that are the farthest advanced in the testing process are now being tested for safety and effectiveness in tens of thousands of people. One vaccine made by the pharmaceutical company called Moderna started their trial, their last phase trial on July 27th. They're giving the vaccine to 30,000 people across 89 different sites in the United States. Another vaccine made by a company called BioNTech, which is a German company, also launched their trial on July 27th. They hope to vaccinate 30,000 people in the United States, Argentina, Brazil, and Germany. And then there's the vaccine developed by the University of Oxford and now working with the pharmaceutical company called AstraZeneca. They have started their last phase trial in England, India, Brazil, and South Africa. And while that trial goes on, they are optimistic enough that it's going to be shown safe and effective. The production of the vaccine has already begun. Now, in addition to those, there are 2 other vaccines that were developed by Chinese companies that are in their final trials in Brazil, Indonesia, and the United Arab Emirates. And while this is all going on, these very important studies to show the safety and effectiveness of vaccines, recently the Russian government announced that it would start using its vaccine in October without adequate studies on the safety and effectiveness. The Chinese military in China may be doing the same with a very similar vaccine. Now, using a vaccine that has not been adequately tested to a general population is something that we don't do in the United States, and I don't think anyone should do. People should not be given a vaccine outside of a research study unless it is proven to be safe and effective. Here in Philadelphia, we will wait until we have those studies to demonstrate that vaccines are safe and effective. But I am optimistic. I do expect that we will have vaccine that is proven safe and effective to offer sometime in the first few months of 2021. We may, in fact, have more than one vaccine at that time that we could be using. Now, as we approach our thinking about delivering vaccine to people, I've heard two concerns that are to a certain extent in conflict with each other. First, I've heard concerns that more people will want this vaccine than can get it. Then I've heard that people will be afraid that the vaccine is not safe and they won't be willing to get it. To a certain extent, those two concerns will actually balance each other out. There's no question in the beginning, with whatever vaccine is first proven to be safe and effective, there will be limited doses available. And so we will set a priority for who gets those vaccination on the people who need it the most, so that we can save the most severe cases and prevent the most deaths. Now, there are already national expert groups that are looking at this to make recommendations on who would be the highest priority groups. And there'll probably be something along the lines of this. First, people who are medically vulnerable, such as elderly people, people with chronic medical conditions, for example, nursing home residents. The second group would be people who might spread infection to those medically vulnerable people. They're caregivers, for example, the medical staff at nursing homes and medical staff at hospitals. Now, that's what would happen at first. Then, as more doses become available, the vaccine will be opened up and made available to others at low risk and ultimately everyone. But because the virus also affects minority populations harder, at every step, we will make sure that they're particularly available to African Americans and other groups that have been most impacted by the virus. So how and where will we offer the vaccine? Well, likely it'll be through a combination of sites, nursing homes, doctors' offices, pharmacies, community clinics, and even freestanding vaccination sites. The first vaccines will likely require 2 different doses, and that will require tracking of those doses in individual people. At the same time, we need to track the doses of the vaccine itself, because we don't want to waste any vaccine when it's going to be in short supply at the beginning. So to do that tracking, any site that's offering vaccine will need to be connected to our Central Philadelphia Immunization Registry. That's an electronic computer database of vaccinations to Philadelphia residents. It's in place now. We're using it for other vaccines now. We can build on that. We're beginning now planning on how to connect those sites that will be offering the vaccine to that immunization registry if they're not already connected. Now, there's much to be worked out, but still, it's exciting to be thinking about through this right now, because ultimately this is the way to end this epidemic. In the meantime, let me remind everybody that the best tools we have, the ones we have in front of us right now, using masks. To remind people, everyone should be wearing a mask when around other people. The mask use is important now as it ever has been. The second thing is to remind people that this virus is particularly risky to medically vulnerable people, people over the age of 65 or people with chronic medical conditions. If you have those, you should stay home as much as possible. Avoid contact with your relatives and caregivers who themselves are out and about and might be bringing the virus into your home. If you need to be exposed to those people who are out and around the home, or that are out and about, make sure that they're wearing a mask and you are wearing a mask. More information and all of our data is at our website, www.phila.gov/testing. I'm sorry, www.phila.gov/COVID. Thank you.
All right, thank you, Armando. And we are now going to move to the Q&A portion for members of the media. Thank you for joining the briefing. And this first round of questions, I should say, is limited to COVID-19. So if you have questions related to the encampments on the Parkway and Ridge Avenue, please hold those questions to the second round. If your hand is raised right now and your question is not on COVID-19, please lower it and we will announce the second round when we get to it. Thank you. Joining us today shortly, we don't have them yet, but joining us will be First Deputy Managing Director Tumar Alexander and Deputy Managing Director for Health and Human Services, Eva Gladstein. Eva and Tumar will be joining us in order to answer questions related to the encampments. Only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. Let us start off with Shira Arias of Telemundo. Shira, you're up.
Hi, yes, hi. So my question is extremely related to COVID-19 directly for Dr. Farley and the CDC. I'm going to go ahead and ask it in Spanish so that he could go ahead and translate it. So, Armando, La pregunta es relacionada con el campamento, pero es sobre COVID-19. La CDC dice que no es factible que los campamentos como estos sean desalojados debido a que podría incrementar el potencial de contaminación de enfermedades infecciosas como es el COVID-19. Entonces, en dado caso, ¿por qué van a desalojar el campamento si la CDC no lo está recomendando? Eso es una pregunta directamente para Dr. Farley.
This is a question for Dr. Farley and is in connection with both COVID-19 and the camps. The CDC has made it clear that it's not advisable to remove and spread the possibility of infectious diseases, including COVID-19, by decamping the people that are gathered. How are they going to proceed, and why are they going to proceed about removing the people from these camps?
Actually, if you look at the CDC recommendations, they point out that there are other risks to people living outdoors, which are serious health risks, and those health risks need to be balanced with the health risks of COVID. And we are concerned about the health risks at these encampments. They're poor sanitary conditions. People are outside at a time when the mosquitoes that might be passing West Nile virus, and they may be passing COVID infection as well. So we are concerned about the health risks, and we think that the CDC guidelines do recognize that it's appropriate to take action under those circumstances.
So we're doing a story about university students going back and starting classes. Obviously, you guys saw in Chapel Hill had to quickly shut down because of the cluster of cases. So I wanted to see if the city is working closely with the universities, and how are you guys making sure that a cluster of cases do not pop up and spread among the student population throughout the city?
We are working closely with all the colleges and universities in Philadelphia. We asked some weeks ago for them to each send their health and safety plan to us. We reviewed those plans, made comments on each one individually, had follow-up conversations with each one individually to try to make those plans as strong as possible. We do think that with that, we can limit the spread of the infection on college campuses. I should be clear, though, limiting the spread doesn't mean that there won't be any cases. We expect that there will be cases in college communities as there are cases in the city as a whole. Our goal is to really prevent the propagation of those, prevent the growth of those. As cases are identified at college campuses, we will be working with them on contact tracing and other steps to reduce the spread. If it turns out that we can't control the spread on college campuses despite those efforts, we might consider closing those campuses, but I'm hoping we won't get to that point.
And do you feel like classes should be returning in person? You know, if I mean, they're 18-year-olds, right? They're all excited to party and go meet each other. But if the cluster of cases starts to pop up, could that eventually spread to the general population of Philadelphia?
Well, the virus is already in the general population in Philadelphia. The real question is, will having more of these students in the city increase the risk to the community as a whole? I don't know that that is likely to occur, given all the safety precautions that these colleges and universities are putting in place. That doesn't mean that everybody's going to follow every rule all the time, as you've seen about the block parties that are occurring in the city. But we do think that the colleges and universities have plenty of opportunity to set standards for safety practices, and we'll work closely with them. If things aren't working, we can change, but we're comfortable with where we are right now.
Thank you.
Thank you, Jacqueline. Let's go now to Jack Tomzik of Metro.
Hello, this is for Dr. Farley. You said that testing has increased, and now the city's doing, the city residents are getting tested about 3,000 times a day. Can you quantify that increase? How much is that compared to, a few weeks ago or last month? How big has the increase been in testing?
A few weeks ago, we were averaging about 2,500 tests per day. And so you can calculate the percentage increase. We are on a long-term increase. If you go back to April, when we're at the peak of the epidemic, we were about 1,200 tests per day, so substantially higher than that. And those, you do need to take that into account when you look at the daily case counts. The more you test, the more cases you will identify.
Yes, and I wanted to ask about that. You said the positivity rate for the past week is 4.1%, right? Is that what?
The past week is 4.0%. It was 4.1% the week before.
Okay. All right, thank you. Those are my questions.
Thank you, Jack. Let's go to Natasha Brown of CBS 3.
Hi, this question is Dr. Farley. It's just in reference to the state health and Dr. Levine earlier this morning, again, reiterating that the state is requiring that all students in a school setting, in an in-person setting, have their mask on the entire time, despite the social distancing outside of eating and possibly some breaks throughout the day. I know that Philadelphia schools obviously are going to be all virtual, but there will be some in-person school settings with Archdiocese archdiocesan schools and things like that. Also with pre-K and the access centers that are going to be set up for students in the city that really need to be in a setting where they can be supervised throughout the school year. How will that work in that situation, in those situations?
So we likewise have recommendations that students are wearing masks at all times, with the exception of meals, and then maybe occasional mask breaks, which are very carefully done so that they're not near to other students at the time. We think that that's the most important single thing that any school can do to prevent the spread of this virus in a school setting. Now, that's not going to be easy as you get to the youngest children. So we recognize that it may be difficult for pre-K children. They should have that done as much as possible. And it certainly are. I have seen pre-K children myself who are able to wear a mask all day. Not all of them will be. The more they can have wearing a mask, the lower the risk for everyone.
Okay, thank you. That's all for now.
Thank you, Natasha. Let's go to Martin Pratt of Philly YBN.
Yes, this is for Dr. Farley. The Yale study that showed a new possible test as far as a saliva test, can you speak to that?
I'm not sure what study you're talking about, so can you tell me a little more?
Sure. Yale, a group of Yale students got together, got funding for a faster test. And there was a study done about the saliva test. So you could theoretically do it at home.
Yeah, there are a number of people, a number of companies that are developing tests that would be quicker and, one hopes, more accurate. So far, nothing has been brought to market and has gotten approval from the FDA that is both rapid and has a high level of accuracy. We wish we had that. And as soon as one comes along, I'm going to be very enthusiastic about promoting it. But at the moment, the ones that have been rapid have not been very accurate.
Secondly, can you speak to the increase by geographical location? Do we see the increase in cases? Is it neighborhood? Is it area?
We're seeing it all over the city. In the past week, we saw more in the sort of near north section of the city than we saw elsewhere, but there were certainly cases everywhere. And so when we do see that, then we see if there's any way that we can provide additional services or communications to that neighborhood to try to limit spread in that area. And we have a map on our website, I believe, that shows the location of cases in the past 2 weeks, so everybody can get a sense for where this is circulating.
Thank you.
Martin, you good?
Yes.
All right. Let's go to Laura McChrystal of the Inquirer.
Hi. First, I have a question on indoor dining. I understand that previously you all had mentioned that an announcement would be made by August 21st, which I think is Friday, about allowing indoor dining. Will that still be true? And what factors will you be looking at to make that decision?
We will have an announcement by Friday, if not earlier. And we're looking at the case rates and the trend in case rates, whether they're rising or falling. We're looking at our contact tracing information to see where the disease is spreading. We're looking at other metrics that we put on our website, which I can't find the exact page, but I can direct it to you, that overall give a sense for how strong our response is.
Hi, I have two quick questions for Dr. Farley. I was wondering, there are a ton of local companies working on vaccine development, and I was wondering if you've heard any updates from them in terms of vaccine development and any trials happening.
There are so many different vaccines that are being developed that I've lost track of them, and there may be some that are being developed by companies in the local area. I'm not familiar with all of them. They are not among the three that are really the closest to the finish line. I can only say that much.
Gotcha. And what sort of role, I know that this is decently far out, but what sort of role can local companies play when it comes to vaccine rollout when that does happen?
I'm not thinking of a key role for companies other than companies that have occupational health clinics, so that may be a site in which the vaccine is offered.
Okay, thanks very much.
Thank you, Kennedy. Let's go to Pat Loeb of KYW.
Dr. Farley, the outline you gave for how a vaccine would be distributed, is that pretty much what you'll be recommending to the CDC by October 1st? And do you know why the city was included in that planning?
Yeah, so for those who don't know, Philadelphia was chosen along with 4 different states to pilot a planning process. I don't know exactly why Philadelphia was chosen. I can tell you that I'm sure that they wanted a diversity of types of locations. And so they have rural areas like North Dakota on there. They also have California, which has quite a diverse population. And I think that they want to have a city. And then Philadelphia also has a very strong immunization registry. We're quite proud of our immunization registry. And so that is makes something to build on for here and an example to use elsewhere. And what I described now, I think is pretty much the model that all are going to follow. There's many, many details to be worked out within that general description, though.
Thank you.
Thank you, Pat. Let's go to Caroline Rodriguez Plaza of Univision.
I would like a first reaction about the COVID alert PA that Dr. Levine announced today for the COVID app, and also if this is going to work if you merge it with the contact tracing project you have in Philadelphia, how these two can be related or merged in order to provide a better understanding in the population of COVID-19.
The question was in English, so I think
Disculpe, Armando.
Dr. Farley can proceed if you want to with the answer.
Okay, so there is an app that people can download on their phone, which was announced today by Secretary Levine, that can assist with contact tracing. The way that the app works is that if people have it on their phone and have it turned on, and someone is identified as a case, and that person can send a message through that effectively so that the other phones that were in proximity to that phone send a message to their owners that it looks like you came close to someone who has COVID infection. And so then you should be in contact with the health department, or you should be quarantined and tested. I haven't seen the app myself. It is just being rolled out today, but that's the basic idea. We see this app as potentially an important adjunct to the contact tracing efforts that we're doing. Our contact tracing right now involves people calling someone with infection, having them remember their contacts, and then give us the phone numbers of those contacts, and we make those phone calls to those contacts. That's great for the people that they tell us about, but there may be people that they're unaware of who they were exposed, maybe even strangers that they were nearby, and this exposure notification app may be able to assist in that. It only works if people have it on their phone and they have it turned on. And so we're all going to learn about how it is rolled out, how people accept it, and how many of the people are actually using this. So we don't know how important an adjunct it will be. We hope it's an important adjunct to our contact tracing.
Yeah.
David Melandra was still having audio problems, but texted me his question. It's for Dr. Farley. It's a follow-up on Dr. Farley's comments of last week regarding the Eagle season and their home opener on September 20th. Question: do you believe at some point that Eagles fans could be in the link for the 2020 NFL season, perhaps in November or December?
I said very unlikely that we would have fans in the opener on September 20th. It's a long season. I'm not willing to speculate what happens over the duration of the entire season.